Hello. Hello, everyone. Hello, everyone. This is County Plastic Surgeons of Washington University. And today I'm going to be talking to you guys a little bit about upper and lower eyelid blepharoplasties. I think the first thing we can do is talk a little bit about why somebody would choose to get an upper eyelid or a lower eyelid blepharoplasty. And then we can talk about some of the different procedures that are offered for that. So, so why would you get an upper eyelid blepharoplasty? So essentially, the reason to do that would be to remove extra skin between your eyelid margin and your eyebrow. So often folks can develop a hood or a fold of extra skin. The medical term for that is dermatochalasis. And over time, that fold of skin can make somebody look more tired. Um, it gives the eyelid less of a crisp appearance. And then if it goes on for a longer period of time, it can also actually obstruct vision. And in fact, sometimes insurance companies will cover upper eyelid blepharoplasties because the visual fields have been obstructed, and that can be dangerous for things like driving, for example. So removing that excess fold of skin is really effective at making that eyelid look a little bit more youthful. Now, it's really important that we leave some of that skin there, especially as we get older, because we do need some redundant skin just for us to be able to close our eyelid. So we can't make somebody's eyelid look like the eyelid of a baby, for example, but it can look a lot more youthful and a lot crisper by removing that skin. But sometimes the eyelid skin can look excessive in the upper eyelid because the eyebrows themselves have come down some. And so when the eyebrow drops, one of the things that can happen is it can crowd that skin between the eyebrow and the eyelid margin. And so, another procedure that can be done either instead of or in conjunction with upper eyelid lifts or upper eyelid blepharoplasties are brow lifts. And so brow lifts are procedures where the brow complex itself is lifted up. And then what that can do is it uncrowds that excess of skin. Also, sometimes patients can have something called ptosis. And ptosis is where one of the or both of the eyelid margins have dropped down so far that they're actually obscuring the pupil or the black part of your eye where the light comes in, and that's how we see. And so ptosis can be caused by many different causes. It can also occur in infants, and different medical processes can also cause ptosis. But one of the causes of ptosis is due to aging. And what happens in ptosis due to aging is that the connective tissue and the eyelid muscle that helps to draw the eyelid up can actually stretch or tear a little bit from the eyelid. And when that happens, the muscle can't lift the eyelid margin as effectively. The eyelid doesn't come up and it actually obscures the pupil. So surgeries can be performed to either reattach that connective tissue or tighten up that connective tissue. And those are called ptosis repairs. And then in the lower eyelid, there can be either an excessive skin or an excessive fat or the contour between the eyelid margin and the midface cannot have a smooth appearance but can look grooved and more aged. So there are lots of different procedures that can be done in the lower eyelid. So for one, excess skin can be removed when there's too much excess skin. That is most effectively done with a procedure or a lower eyelid blepharoplasty where some of that extra skin is actually cut away. Sometimes there's just a small amount of excess skin or crepey skin, and then that can be addressed with laser, which can be used to tighten that skin up. In other instances, there can also be more fatty tissue, essentially pooching from the lower eyelid. And when that's the case, that fatty tissue can be removed very often. And that can be done either through an incision underneath the eyelid margin when the skin is being removed, or it can be removed sort of inside out from the inner lining of the eyelid, and the fat can also be removed that way. In some cases, what we'll do is rather than remove the eyelid fat, we'll just reposition the eyelid fat. So rather than it looking poochy, we redistribute it so it actually causes a smoothening of the junction between the lower eyelid and the midface or the central face or the cheek area. Now, sometimes also when the eyelid has been lifted, there can also be a drop in the position of the eyelid. So oftentimes we'll also do surgeries or procedures to tighten that lower eyelid so that it sits in the correct position. And those operations are called canthopexes or canthoplasties. And again, they're done to set the position of the lower eyelid margin so that it creates a nice, youthful position and its relationship to your eyeball itself. So to review, in terms of the types of procedures, brow lifts can be used to raise the eyebrow. Blepharoplasties can be used to remove the extra skin, sometimes fatty tissue of the upper eyelid or a strip of muscle, and they can also be done with eyelid lifts to try and address something called ptosis. And then for the lower eyelid, we can remove skin, we can remove or reposition fat, we can tighten the eyelid margin, and then we can also tighten up crepey appearing skin. And that is done with a combination of brow lift procedures, upper and lower eyelid blepharoplasties, and then also laser resurfacing procedures. In terms of where we do these procedures, so procedures like upper eyelid blepharoplasties are often just done under local anesthetic in the office. And many of the ptosis repairs can also be done under local anesthetic in the office. So that's a comfortable way for patients to do that without general anesthesia. However, when we're talking about doing more extensive procedures of the upper eyelid or brow lifts or doing lower eyelid blepharoplasties or fat removal, then typically those will be done in the operating room under general anesthesia. Now, blepharoplasties can also be combined with lots of other facial aesthetic procedures. So very often we'll combine upper or lower eyelid blepharoplasties or brow lifts with procedures such as facelift procedures, sometimes with fat grafting to the face, sometimes with laser resurfacing procedures or chin implants or even rhinoplasties in some cases. In terms of recovery time, so upper eyelid blepharoplasties, patients typically are, I think, they can be somewhat bruised and swollen, where it's noticeable, for a couple of weeks. For lower eyelid blepharoplasties, often swelling and bruising can last a little bit longer, especially if it's combined with things like fat grafting or more extensive procedures to set the eyelid margin. Brow lifts also can be associated with some bruising around the upper brow area or around the eye socket area as well. But in general terms, most people have resolution of the more obvious swelling and bruising within a couple weeks of the procedure. But we will also ask our patients to do things like stop any aspirin or any blood thinners to try to reduce bruising, but also to make the procedure safer since we are operating around the eye. All right. Well, thank you very much. It was a pleasure to talk to you guys today, and please tune in for the next Facebook Live from West County Plastic Surgeons in the near future. Have a great day. Thank you.